Cure Talks. I'm Priya Menon, and today we are discussing gun violence and its impact on healthcare. Every single day in America, health professionals find themselves on the front lines of treating patients injured by firearms. From emergency departments and primary care settings to behavioral health and specialty care, these professionals grapple with not only tragic and firearm related injuries and mortality, but invisible wounds that firearms inflict on individuals, their families, and communities. Despite the epidemic level of firearm related mortality and injury, gun violence is predominantly a political or criminal justice issue rather than a health issue. Of course, any discussion must recognize the role of politics in this. Today's talk, but is not about the politics. It's about what happens in the ambulances, the hospitals. It's about the places where gunshot victims take their last breath. Despite the best efforts of medical teams, we will discuss the impacts of gun violence from the perspective of the medical professionals on the front lines of America's gun violence epidemic. Dr. Therese Richmond will share her perspectives on gun violence from public health and research experience that she has, and we will hear perspectives from the emergency room from Dr. Zafar Qasim and Dr. Chidinma Wakanma. Dr. Richmond is Professor and Associate Dean for Research and Innovation at Penn School of Nursing. Dr. Qasim is Assistant Professor of Clinical Emergency Medicine. Dr. Wakanma is Physician and Assistant Professor of Clinical Emergency Medicine at University of Pennsylvania. Extend a very warm welcome to our esteemed panel here. Thank you everyone for taking the time to join me on Cure Talks today.
Glad to be here.
Thank you very much.
Starting off with the very first question, I want to hear about how, from each one of you, how you decided, or that particular moment or incident that helped you decide that to become a gun violence advocate. Dr. Richmond, you've talked and researched a lot about gun violence. And can you talk a little bit about how you first started to think about firearms as a public health issue and the particular story that made you realize that this is where you want to focus?
Well, for me, it started quite a long time ago. I would say in the late 1970s, early 1980s. When I was working as a clinical nurse in a trauma center in Washington, D.C. And at that time, gun violence was a huge issue, not unlike what we see today. And I worked in resuscitation and critical care and followed and took care of people on a day-to-day basis. So one of my patients was a man named Andy. And Andy came to us after a close range shotgun wound to his abdomen in a robbery gone wrong. And really, by all accounts, Andy should have died. It was a devastating injury. He was with us in the ICU for months, but he survived. And I will say, as clinicians, we all sort of patted ourselves on the back and said, what a good job we did, and this was fabulous. But one of the things that made me wake up and say, what's happening here is Andy came back to visit us maybe a couple months after he was discharged from the hospital. And he was irate. He was beyond irate. And he came in our ICU and started yelling at us. And he goes, "You saved my life, but I am not healed. And nobody understands what I went through. And my life will never be the same again." And it was the first time I thought beyond the ICU doors. And I thought, what happens to people? And that was a really important point in my life. And it really took me down two paths. What happens to people who survive gunshot wounds? And then how do we stop it? How do we move upstream and stop it? So that really was what started me down this path. And I've been on the path ever since.
Thank you. Thank you for sharing that, Dr. Richmond. Dr. Qasim, you are a practicing emergency physician. Do you have a story too that you could share with us about a patient who was affected and how that experience drew you into becoming a gun violence advocate?
Yeah, thank you for the question. And I think, for me, it's probably not one particular patient story, but probably a combination of cases. I moved to the US about 10 years ago, and I've worked at high volume trauma centers throughout my time here. And, you know, as you're working, by and large, the patients that you see being shot, you notice certain similarities. Oftentimes they're from poor socioeconomic backgrounds, largely Black patients. Sometimes they're kids, sometimes they're teenagers. And, you know, having to tell the parents of these children that they're critically injured, they maybe have been left paralyzed or that they've been killed is difficult. And no matter how many times you're doing it. And when you hear stories from the mother or the father that their child was actually just getting into school or college or finishing a degree or starting a business, it becomes even more painful to kind of deal with that. And certainly one recent victim we had just returned to Philadelphia with a friend of his with a plan to finalize a business deal. They were setting up a business. And more recently, we had a spate of shootings that came in, a number of victims who came in who were actually at a vigil for a person who'd been shot just the previous week. And so when you hear all of these stories of how needless this violence is and how these people are plucked out of the prime of their life, you know, you come to think that, you know, we need to look at this more objectively and we need to do something about this to prevent all this needless violence. So I would say a combination of all those has kind of driven me in this direction.
Absolutely. Thank you. Thank you, Dr. Qasim. Dr. Wakama, I have the same question for you. Was there a particular story or moment when you realized that this is where you wanted to focus?
Yeah, thank you for the question. Yeah, I do think that there was a particular moment or two moments where I felt like, okay, this is something that I think is necessary for me to put my attention towards. And one of those moments was there was a day where we had this onslaught of gun violence, like this trauma after trauma after trauma after trauma. And I remember feeling very like desensitized by it. And as Dr. Qasim said, most of the victims are Black, young Black males. And I had, actually that day, there was a white male that came in as a victim of trauma. And one of my colleagues said, oh, that could have been my son. And I felt as a Black physician, you know, I'm seeing Black bodies every single day. And, you know, that could be my son, that could be my nephew, my cousin, my brother, my father. And so as one of the few Black physicians in the emergency room, I felt a certain amount of responsibility to jump into this field, because who am I waiting for to do that? I'm feeling a certain pull to my community as a Black physician. And that was one of the driving forces for me to become, I guess, an advocate at this point for gun violence. The other thing was I actually moved from Center City to West Philly. So now I'm actually living in the community that we serve. And ironically, on my first night living in my new house, I actually heard some gunshots. And then there was I don't know if you guys know about the Citizens app, but it sent out that there was a shooting at this cross street, and it wasn't too far from where I just moved. And so I literally drove behind the ambulance. I was going to work that night. I literally drove behind the ambulance and pulled up to the trauma bay with the ambulance, and then took care of that person that had gotten shot in my community. So it just kind of brought it home that this is not something that's happening over there. This is not something that's happening to them, but it's happening to us, and it's happening in my community. So those were the two things that really made me wake up and say, okay, yeah, I can't just be piecing together bodies every single day. I need to do something to aid in the prevention.
Absolutely, the impact is really devastating and wide-reaching, I should say. Circling back, Dr. Richmond, the topic, as we all know today, we're discussing is gun violence and its impact on healthcare. It would be great if you could talk a little bit about what, according to you, is the impact on health, well-being, and healthcare in general.
Well, you know, I think the impact on healthcare as providers, we see on a daily basis man's inhumanity to man. And it's unbelievable what people do to each other. And I think that takes a toll. We saw in the pandemic, I think the public actually saw the toll that COVID took on healthcare providers. It was all over the news. they really highlighted that. But we don't see that with gun violence. It's like, that's not in the media, that's not what people see. And yet clinicians and providers see that every single day, and it takes a toll. I'll say from a healthcare system perspective, the fact that we live in communities with such high levels of gun violence alters our clinical spaces. And it alters our clinical spaces in ways that can be challenging and problematic. So for example, in Philadelphia, there's a policy that police can transport injured people in the back seats of police cars. And usually that's gunshot victims. And you know, that could be good in many ways because it can really facilitate rapid transport to emergency departments and trauma centers. But the other thing that it does is it gives police entree into our clinical spaces. And that entree into our clinical spaces changes the feeling tone, changes the interactions that we have with patients. And we see firsthand the intersection between trauma care, emergency care, law enforcement, and race. And we see they play out in our clinical spaces. So we did a study where we really we're trying to understand the implications of that. And I'll just read one quote from that. So this is from a patient who was shot, and he goes, you know, the doctor's sitting there trying to operate on me and the detective is coming around them. Do you know who did this to you? Do you know his name? Do you know where he lives? I could hardly breathe. You want to sit here and ask me questions while I'm getting ready to die. Well, nothing in nursing school prepared me to deal with those kinds of interactions in clinical settings. And I don't think that's at all what we think about when we think about patient-centered care, right? And really meeting needs of patients. So I'm just using that because you asked about the healthcare space, and say, I think the impact of that is that people start conflating law enforcement and healthcare because we're both bureaucratic systems, and we lose trust. And I think the last thing we need is for patients and people in our communities to lose trust in us as healthcare providers. So we really need to think hard about that. So I'll leave it at that and talk specifically about the healthcare system there, and pass that off to you then.
Yeah. So what about, you know, health and well-being in general? Of course, you did mention, you know, you touched upon healthcare, but could you talk about, you know, the general impact on health and well-being of a person involved and people around?
Well, certainly on the person involved, it's a huge impact, right? So it's an impact in terms of, do you survive? And it's an impact in terms of, if I survive, what's that survival like? And so just the individual, there's a huge impact. So for example, and just to contextualize so people really understand this, I did a study, I engaged a colleague from Wharton, Jean Lemaire, who's an actuarial scientist, which is not a skill set that I have. And we were interested in what's the impact on firearm violence or living in a world with guns. And what we found is Black men, and Chidi talked about this, this is the population who's disproportionately affected. Black men lose over a year of life expectancy because we live in a world with guns. A year, 371 days to be exact. And just to like try to say, well, what does that mean? Like a year, so I live till I'm 77 versus 78. That loss of life expectancy for Black men is more than the loss of life expectancy when we combine lung, colon, and prostate cancer together. So it really shows you the impact on health and well-being of individuals, and it's profound.
Dr. Wakanma, you want to jump in and add here?
Yeah,
I believe.
I agree with everything that she's saying. I think from the health side or the clinician side, what we're seeing is that people aren't just dying, is the debilitation afterwards that causes a lot of strain on the healthcare system. And that, I think, is the big impact there. I think that the quote is an estimated like $229 billion that from the American economy that goes towards gun violence as a result of gun violence, I should say. And what we're seeing in the ERs, we're seeing a lot of debilitated young Black men. And what I mean by that is they're paraplegic, quadriplegic, colostomy bags, bed sores, sepsis as a result of these gun injuries from gun violence. And it really is just driving up the cost of the need for home health aides, healthcare in the home, rehab facilities. There's frequent ER visits because of infection or pain. So it really does have a huge impact on healthcare and what we're seeing, and not to mention the effects of mental health afterwards for the victims, for the families, and chronic pain that comes as a result of some of these injuries. So we're really seeing this kind of multifaceted effect from gun violence in the ERs and in our clinical spaces that is something that is devastating. And it's crazy that it's something that's not from a natural cause, but it's something that could potentially be preventative. And that's the sad part about it.
Absolutely. So what I understand is, whichever way you go, the impact is devastating. It is not the person alone who is affected. It's this huge circle of people around the victim, family, community, another circle of care, medical providers who get drawn into this, and the numbers are concerning, not to mention the psychological impact of all this. And I believe, what I feel, that gun violence should certainly be discussed with the stakeholders, especially the healthcare workers too. So my next question is for all of us, all three of you. And I'd like to start with Dr. Richmond, that we are discussing gun violence and healthcare. So do you agree that gun violence is a public health issue? And if so, can you share your reasons on why you think this could be classified as a public health issue, and go on to talk a little bit about what public health issue would involve? Of course, it's about prevention. So do you foresee any difficulties, any hurdles that such an approach may have, or any advantages that this would have to actually bring about changes?
Well, absolutely, it's a public health problem, and it's absolutely a health problem, right? So let's think about the health problem. When somebody's shot, they come into the emergency department. It's no different than a heart attack, a stroke, pneumonia, symptoms from any other disease that we have. But when we think beyond the individual and we say, let's think about the population, right? The population as a whole, or even subsets of the population, we see what a huge toll that it takes. So if we think about in 40 years, now I'm older than 40. So in 40 years, the last 40 years of my life, we've seen 1.2 million deaths in the US from guns. If that's not a public health problem, I don't know what is. I mean, really. And we certainly see it playing out in Philadelphia. So if we think about the prevalence of the problem, the impact on health and well-being, the economic costs to society, we can't ignore it as a top public health priority. So it's absolutely a top public health problem. It's an epidemic, 1.2 million deaths in 40 years. I don't think anybody would say is within an acceptable range. So I think that answers your question. I don't know if you were asking specifically about prevention, but I'll stop there, and we can always come back to prevention if you like.
I'll move on to Dr. Qasim. Dr. Qasim, what is your opinion on tackling violence as a public health issue?
Yeah, I think certainly it is very much a public health issue, and I think the pandemic has really highlighted what public health means to the world, really, and certainly the United States. We see all the issues surrounding mask wearing and all these, try and prevent kind of spread of COVID-19. And really, if you look at it, then gun violence is an epidemic that's been there before the pandemic. It's been exacerbated by the pandemic, and unless we do something about it, it's an epidemic that's going to continue after, the pandemic kind of settles. And certainly, it's like a disease. It's kind of pervasive. It causes destruction to the victim, to the victim's family, to the society. It spreads because there's a sense of, say, retribution and need to shoot people in terms of revenge of previous shooting. And it creates kind of direct and ongoing injury to a number of people, which will continue and worsen unless it's addressed. And so, just look at other things that we had. You go back to the 70s and we had a number of automobiles coming onto the streets. People were driving drunk, people were driving at high speed, and there were a number of accidents and people were losing their lives. And that was seen then as a public health issue, and that was addressed. So, speed limits were introduced, drunk driving laws were introduced, seat belts were introduced, car seats were introduced for children. And all these were, accepted because people looked at this problem, they studied it, they identified where the problem was, they identified solutions, and then they implemented solutions that were then accepted and enforced by the society as a whole. And unfortunately, with gun violence, no matter how much we want to kind of steer away from politics, inevitably politics kind of comes into this, because there are specific laws like the Dickey Amendment of 1996 that specifically states that if I wanted to research gun violence tomorrow and sought NIH funding or funding from the CDC to do that, I, by law, am not able to do that. And that's a big restriction in terms of us as scientists who are looking to identify and further characterize this problem and the effects objectively, without bias in the public health and medicine perspective. And so we can't approach this the same way that we did car accidents, just for that reason as well as other reasons. And then inevitably there's backlash from lobbying organizations. A recent example was there was a study in a pediatric journal that was published that identified issues surrounding gun violence and gun use, that then released a large social media backlash from one of the prominent gun, I'll say, quote unquote, rights groups in this country, that we as physicians should stay in our lane in terms of addressing gun violence issues. And really, to be honest, this is our lane. But to have this backlash from these organizations that carry a lot of followers and a lot of public opinion really stymies our efforts in an attempt to address an ongoing problem that's been there for a very long time and will continue unless we have the opportunity to address it just like any other public health emergency that we're facing. And no doubt that this is a public health emergency that we have not addressed effectively for a long time in this country.
So can I add in for a minute on something that Zach said in terms of the motor vehicle crash? It's really an excellent example. And it actually, I think, identifying it as a health priority happened way before the 70s. I think we saw a lot of technology introduced in the 70s, but it was in the 1930s that FDR, who president at the time, identified motor vehicle crash as a national priority, and that we needed to decrease death by cars. And that was the 1930s, and the decrease in death by cars really was one of the top 10 public health successes of the 20th century. So that unfolded over 60 or 70 years, but it worked, and it worked for several reasons. One is there was a surveillance system. There was a lead agency. We have NHTSA. There was stable funding for researchers, which is problematic. We had data accessible to researchers, which is problematic with gun violence. We had interdisciplinary approaches, physicians and nurses and engineers and street designers, and we researched all possible points of intervention. And I think the really important take-home point is we know what it takes. We know how to do it. We know these elements need to be in place. We just have to have the will and remove restrictions that prevent us from doing that. And I think the biggest take-home point, if we're trying to figure out how to come together around a problem, is we have more cars in this country now than we did in the 30s, than we did in the 70s. We have more miles driven per person than we did in the 70s, than we did in the 30s, and yet we have decreased death by car. So that is a wonderful case study in public health approaches to decrease injury that are directly applicable to the issue of gun violence.
Absolutely, that is definitely a great example. Quite doable too, as you said, Dr. Richmond, if you have the will and and support, I guess. So, a professional, Dr. Vakanma, I'm just going to skip over to the next question. We've heard we've been talking about public health issue, and can you tell me, like, what could be, Dr. Richmond here outlined how considering it as a public health issue can have advantages, and how maybe in a long run we can actually, help reduce gun violence in the country. What could be some of the other pros or some of the disadvantage of looking at it or looking at this approach? Can you talk a little bit about this?
Yeah, of course. So I honestly don't think that there are any disadvantages of looking at gun violence as a public health issue. I do think that the advantages are, like my colleagues are saying here, it really legitimizes gun violence as an issue that the public needs to give their attention to, as opposed to something that is just happens because someone is criminal, or they're just bad, or they deserved it, or it just legitimizes it as an issue. And I think once you legitimize it, then you can start looking at the root causes and start examining it. And I know we were using the example of like motor vehicle accidents, but I can also look at like the war on drugs, or the opiate epidemic. Once that was identified as, oh, this is a public health issue, then that's when we started having strategies. Serious funding started to go into it. We had Suboxone programs. We had Narcan being passed out readily. And there was a lot of national programming and researching that poured into opiate abuse and this approach to controlling the deaths and the mortality and the morbidity in the hands of drugs. And I do feel like we have a lot of case studies here that we've seen. I think opiates would probably be the most recent one, but we've seen case studies where these issues have been taken more seriously because they were determined to be public health issues. So I don't think that gun violence is any different. I think that making it a public health issue definitely does legitimize it and makes people and allows people to understand that this is something that's, one, preventable, and two, widespread and affects all of us, even if you're not directly a victim of gun violence. So I really am trying to rack my brain to think of any disadvantages or cons, and I really don't have any.
That's good. Thank you, Dr. Vakanma. Dr. Qasim, my next question is for you. So professional organizations for clinicians, such as the American College of Physicians, are encouraging physicians and healthcare workers to talk to patients about guns in their homes. And with the surge in activism around firearms, the concept of gun violence as a public health issue that we've also been discussing has gained much traction even outside of the public health community. So as I understand, it's a perfect topic for clinicians and public health professionals to think about together. What I want to know from you is how do you recommend that physicians talk about firearms with the patients? What and how would you go about something like this?
Yeah, I think that's a key question to ask. And I think we have a lot of opportunity as healthcare workers to discuss this with our patients. And I liken it to, when some of our patients present with, say, drug or alcohol problems, it sometimes provides a in the moment opportunity to kind of provide some guidance or information that may affect change. And there's some evidence to support the benefit of doing that in other issues as well. But I think, a couple of things just to take into account is that, being frank, open, and in particular non-judgmental is really key. The patient themselves may not want to disclose that they have a firearm in their home, for fear that, they might be, there might be legal repercussions or something like that. And so it's really important to develop a sense of trust that you're asking really for their safety or perhaps their family's safety about the presence of a gun. And certainly our nurses tend to ask about this question. We do as well when we're dealing with someone who is maybe suicidal or is a victim of domestic abuse or something like that. But I think there are other opportunities also, including some of our, when our victims come in, whether there's also a firearm in their home that may be accessible. A lot of us may have biases about gun ownership and, of course, the effects of gun use, but I think there's not really a place to bring that bias into the conversation when you're talking to your patient there and then. And it's important to understand, especially living in this country, that safe gun ownership is in some families is a tradition, and it's the reason a lot of people might be against people talking about banning guns and things is because traditionally they've had guns in their families for a long time and they've used them safely. So taking your bias out of it, just understanding a little bit from the cultural perspective as well, why people may have a gun in their home is important to understand. But other things that you can talk about is not only, if they have a gun in their home or not, is whether they're storing that gun safely, asking questions around that. How do you store your gun? Do you have a gun safe? Do you have a gun lock? Do you store your ammunition separately from the gun? Have you thought about, is this gun in a place that my child is not able to access it? Because there's a lot of unfortunate incidents where people think that they've sort of stored their gun in a secure place, but kids being kids, they get access to the weapon, and if it's loaded and not locked and secured, then unfortunately, they might shoot themselves or they might shoot another member of the family. And so not only kind of the fact that they have a gun, but also are they responsibly storing that weapon while at home as well. So there's lots of different opportunities to do that. I think ultimately, we have to be open and frank about it, develop a nice, quick rapport with the patient so that they trust us, and then talk about kind of the wider issue as well. So use that opportunity, that short period of time you have, to the best effect.
Dr. Qasim, so exposure to violence really increases the risk of lifetime medical problems too. I know it's not only the deaths, it's the spinal cord injuries, traumatic brain injuries, mental health problems. Can you comment on this by touching upon some of the common medical problems that you have seen in your time in the emergency and trauma center?
Yeah, that's a great question. Thank you for that. And certainly exposure to gun violence can be extremely stress-inducing for anyone involved, the victim and those around them. And we know that there are certainly disturbances in brain and body physiology that occur over time, directly and indirectly to the people involved. And this can lead to abnormal coping mechanisms, which can ultimately lead to poor health. And there's actually, just in this past month's Annals of Emergency Medicine, my colleague, Dr. Gina South, published an article looking at the short-term effects of gun violence and presentations to the emergency department, and found that people would present more with syncopal episodes soon after a gun violence exposure. But in the longer term, we've also seen evidence that this can manifest as many mental health issues, primarily depression, suicidal thoughts, and ultimately that can lead to disregard for personal health in general, and that can worsen chronic health problems like hypertension and diabetes. And these are issues that can also be kind of indirectly affected by gun violence as well. Say, for example, if that episode of gun violence leads to a loss of financial security, that can add to the fact that, a lot of these victims are, number one, from poor socioeconomic areas anyway, and we see a lot of racial disparity in terms of healthcare access in general. And so their chronic health problems can be exacerbated further just from the fact that they now may not have a source of income, and certainly then can't take care of their chronic health needs. So we'll see kind of the indirect effects that almost kind of domino effect of problems that can lead on from just an exposure to gun violence directly to the victim as well as to those around them. Some of the things Dr. Wakama mentioned that, some of these victims are now disabled. They may not be in a position then to adjust their home to, say, manage a wheelchair or something like that. They may be confined to their home. They then develop problems from not being able to access healthcare. So we might see them come in as a result of infections or other problems related to bed sores, things like that have developed at home. And similarly, the caretakers for these patients will often be suffering financially because they're taking care of their loved one. And so again, that domino effect of health issues that can result of that because they're not in a position then or don't have the time or the means to address their own problems. So they might have pretty devastating consequences of chronic health problems. So as you can see, it kind of manifests in broad manners, all both in the short and the long term for the victims as well as those living with them as well.
Dr. Wakanma, I'm going to move away from the victim to the health of the healthcare workers, the frontline workers who are giving this care. How does the constant viewing of trauma affect you, your colleagues? How do you manage this? How do you go through this?
So that is a very difficult question because I've been trying to ask myself this for many years now. What's going to be the effect of this? Because I don't think I'm seeing it right now, but I do think that there will be some type of long-term effect. Because think about it, we're seeing death and dead bodies and destruction every single day. That's kind of similar to what soldiers see in war, and they are, have a lot of mental health issues. PTSD. So I'm wondering if when you study the brains of the doctors that are taking care of these patients in another 20 or 30 years, what the effects would be. Day-to-day effects, we are I think, and this is my opinion, that we're very desensitized to death at this time because we have to be. In order for us to do our jobs and in order for us to work very efficiently, we have to take a lot of emotion out of assessments and resuscitative efforts so that we can zero in and make sure that we're doing the best thing for the patient without being overwhelmed with sadness or grief for these patients and their families. And so I do think that there's a desensitizing that happens with physicians. My residents have been coming to me, especially on days that have been particularly heavy violence days. They have come to me and said how they felt overwhelmed or how they felt sad or just needing to take a minute before going to see the next patient. And so there is this fatigue that you get from seeing constant trauma, constant death. And I do believe that it is taking a toll on our mental health. I'm not sure different people are able to deal with it in different ways, but I do think that there's something that's undeniable. It's affecting all of us. And like I said, I have a unique perspective as a Black physician. Seeing Black bodies over and over and over does do something to me. And I'm sure it does something to a lot of other Black physicians that are in this position because we are seeing people that look like us being killed and dying. And it is something that I do think affects me. I just don't know the gravity of it yet. And that's very concerning.
Dr. Richmond, what is your opinion on this? How does this actually affect people who are giving this care in the medical emergency rooms?
I think I spoke to that a little bit earlier, so I'm not sure I can add much more to what my colleagues have said. I would like to just switch a little bit to say, and Zach touched on this very well, the mental health consequences of gun violence on individuals who are shot. And we've shown that without a doubt, and the impact of that on their lives, but their families, but also think about the youth in our community who are living in pervasively violent communities, who are exposed to gun violence almost on a daily basis. What we found in our work when we talk to youth, and we've done a variety of studies with 10 to 16-year-olds in West and Southwest Philadelphia. This is our community. This is who we serve. And what we find is 87% had directly witnessed violence, and primarily gun violence. And 54% have been directly victimized, not necessarily by guns, but directly victimized. So when you're 10 to 16 years old and you're witnessing and hearing about and experiencing violence on a daily basis, there's an impact on that. And there's an impact on their development. There's an impact on the absolute chronic stress that they bear as a result of that. So I think we need to make sure everybody understands it has an impact on healthcare providers. It has an impact on the individual who's shot. Has an impact on their immediate family, but it has a huge impact on communities and children who are growing up in these communities. And I guess the final thing I'll say about sort of the impact is it drives decisions about resource allocation in ways that are probably not helpful to the growth and development of healthy communities. So if we're spending money on metal detectors to get into schools and we don't have sufficient books for our children, that's a problem, right? And we don't think about that as we think about gun violence, but we better darn well be thinking about that, because the allocation of resources in terms of the broader health of families and communities is going to have a long-term impact.
Dr. Richmond, can you talk a little bit? I know we did touch about prevention, gun violence prevention, but could you talk a little bit more about what is being done in terms of preventing gun violence, in terms of research? Can you touch upon those points?
Well, I think first of all, public health, if we want to really improve the health of the nation, it's all about prevention. It starts with prevention. And, you know, the three of us are at the end point, right? We see you're shot, you come into our setting. And we have to, and we've all committed to moving upstream to the prevention. So there's a couple things I'd like people to think about. One is, and my colleague talked about this, you know, in terms of how physicians talk to patients about guns. And we've gotten critiqued by a variety of people in the country for you have no right to worry about prevention of gun violence. Well, certainly we do. And I liken it to, of course we need to do that. Let's think of an analogy. Somebody has a myocardial infarction or a heart attack and they come into our emergency department and we're providing emergent care for them. Think about if the healthcare community didn't also focus on prevention of heart disease, didn't focus on poor diet, on obesity, didn't focus on blood pressure control, didn't focus on get your cholesterol down and everything. I would say the majority of the world would view us as being negligent at best, or it would be malpractice at worst. So how is gun violence any different than that? So that's just, of course, we have to move upstream. The thing I would say in terms of prevention is it opens up a repertoire of interventions that take us away from yes gun, no gun. It opens up, can I change somebody's behavior? Can I change the environment in which you're at risk? So for example, we have a pen. We have, if students are going home late at night, call people to walk you home. We have better lighting. We have, social supervision within communities. I can certainly look at somebody's behavior. I can look at the interaction of alcohol and gun violence. I can look at the environments in which gun violence occurs, whether it's economic or physical or social. My colleague, Charlie Branis at Columbia, did a whole study on greening vacant lots, right? So take poorly used land, make that land better, and he could show in a very well done study a decrease in gun violence. He's doing the same thing now with abandoned houses. So if you manage abandoned houses, if you change the environment, can you decrease gun violence? So I think the public health prevention approach opens up so many avenues that I can change one thing and alter the outcome, which in this case is being shot by a gun.
Thank you. Thank you, Dr. Richmond. That was very well said, I should say. That's really worth thinking about. So I have just one last question. I know this has been a great discussion. We'll have just one last question and then take some of the audience questions that have come in. So my question is, what can each of us do to tackle the problem of firearm violence and improve safety in our communities? I know, Dr. Richmond, you gave us some thoughts, some points to think about. So I'd like each one of you to weigh in, and then we'll go on to the audience. Dr. Richmond, you can start first.
Okay, well, I think the first thing we have to do is to find common ground. We live in a world right now that is just so like this versus how do we come together for something? I think we need to speak from facts and separate facts from opinions, right? Here are the facts. I might have a difference of opinion, but let's separate facts from opinions. I think we need to understand that words matter and how we use words matter. So it's not about pro-gun, anti-gun. It's how do we keep people and communities safe? Like, can you join me to help keep our communities safe? And just recast the conversation. All of us can do that. And I think Zaf made this point so well in talking about how do we counsel people about firearms. We have to understand there's a lot of different views in the world. But I think what's in common is we all want to be safe. How we feel and what we do to make ourselves safe may differ, but all of us want to be safe. And then I absolutely think, and this is bigger than me as a nurse or physicians, we absolutely have to look at the gross social inequities and economic inequities in the world and start taking them on and providing opportunities for people. So that would be my recommendation.
Thank you, Dr. Richmond. Dr. Qasim?
Yeah, those are all great recommendations from Dr. Richmond. I think, I would say that we need to really kind of focus on us being allowed to kind of do our job, which is, gathering that information that helps shape this argument. And so, getting involved with advocacy in terms of allowing changes in laws and regulations that thus far prevented us from studying this problem to the full kind of research effect is certainly one way. And similarly, getting involved in your community as well, I think is important. I think there's a big trust issue, especially in some of the communities that we serve between physicians and the general public, and there's a long history behind that. And so, getting involved in the communities that you live in and the people that you treat is an important aspect as well, not only to gain trust, but also to understand kind of where people are coming from in terms of what's the challenge. And once you understand the challenge, just like we do in science in general, we'll be able to maybe prefer solutions for that. So just a couple of things that I think we can do.
Thank you, Dr. Kasim. Dr. Wakanma?
Yeah, I think understanding that gun violence is this multifactorial thing or entity is something that is helpful in trying to think about ways to combat it. So there are different things. Dr. Richmond talked about just the green spaces and the vacant lots and just the overall investment in dilapidated communities and fractured communities and neighborhoods goes a long way in preventing gun violence. And so we know that, you know, homelessness, we know that unemployment, we know that mental health has an effect, we know that community involvement has an effect, and then us on the clinical side, we're a catchment area for people coming in, victims of gun violence, families of victims of gun violence, potential victims of gun violence. So as clinicians, we have a point of contact that is unique to us. And, you know, just the same way that we counsel people about taking their medications and making sure that their diet and their exercise is appropriate for their daily activity, we should be doing the same thing with gun violence. So I think that because there are so many factors that are affected, there's a lot of ways that you can, even if you're not a doctor, if you're not a nurse or just a community member, there are a lot of ways that you can jump in to at least do your part or do your piece of the puzzle to make sure that overall the net goal is to decrease gun violence. So I think addressing, like we said, thinking about gun violence as a public health issue and making sure that it's something serious and seen as a threat to our life at this point, and that's nationally, not just people who are the direct victims, is huge. But also, you know, making sure that all these different pieces are collaborative, making sure that no one's working in silos, that the community, the hospitals, the primary care, the federal infrastructure, that all these things are happening together and collaboratively, because if it's happening in silos, nothing's gonna happen. And I think that's what's been happening for a lot of decades. You know, each piece is trying to do its part, but I think if we collaborate and we know what the other hand is doing, we're able to scratch each other's backs. And I think that that's the way that we're going to have a net effect that's going to be a decrease. So yeah, I think looking at it as a collaborative, and then also making sure that you fit in where you are, fit in where you can, and do what you can on your scale.
Yeah, so the takeaway being coming together for a common cause, as Dr. Richmond also specified. Great, it's been great. I think we discussed quite a few interesting things. I see, I'm just looking at the questions here. I think we have touched upon quite a few of them, but I'm going to read out the questions because these have been sent in. And you know, our audience might be listening in to hear exactly what the answers are. So, Dr. Kasim, I think you can take this because you were the one who mentioned Dickey Amendment. So the question is, what exactly does a Dickey Amendment say, and how has it affected your ability to perform research?
Yeah, to paraphrase the the Dickey Amendment, that was this was passed back in the late '90s, and kind of specifically restricted the use of federal funding for the towards kind of research into gun violence and kind of the contribution of guns towards violence, essentially kind of preventing us from attaining federal funding for researching this particular problem. And so, you know, of course, that becomes a big challenge because, you know, then you know, it places real restrictions on us that are punishable by fines and other things to prevent us from doing our work. So trying to, you know, it was an amendment, and so amendments can be amended again. And so, you know, I think one of the things that we should focus on is kind of addressing opportunities to bring this back into the light, especially I think as we get more insight into how big a problem this is. And I think, you know, this past year certainly highlighted that even more, that we should be allowed to utilize some funding from the government to address this public health problem. But that's a big kind of challenge certainly for us.
Yeah, so there's another question on the, you know, the kind of research that's happening. Dr. Richmond, maybe I think you can take this. The question is, why is there no research happening about gun violence?
Well, first, there is not no research happening for gun violence. So first of all, there is research happening. So let me just recast the question. Second, just going back to the Dickey Amendment, that had a chilling effect on funding of research. And it said none of the funds made available for injury prevention and control at CDC may be used to advocate or promote gun control. So that's important to understand that language, because it didn't say we couldn't do research. It said you can't use it to advocate for gun control, but it's been interpreted as not being able to do research. And that's why we saw a real drop in research funding. There's some glimpses of hope. So after Sandy Hook in 2013, we saw actually a program announcement from NIH focused on firearm violence. That lasted for about 4 years and it went away. The last 2 years, we've seen $25 million allocated to NIH and CDC. So it's split, so 12.5 and 12.5, focused on firearm violence. That's great. And 25 million sounds like a lot of money, but it is a drop in the bucket for the magnitude of the problem. So the limited research is because of limited funding. We've seen people really be able to work around the limited funding and frame their grants in ways to get research done. But it's had a chilling effect on the next generation of researchers coming up, because who wants to be, think about academics, who wants to be in an academic setting doing gun violence research when I have to get funded and published to be promoted, and the money is really, really tight. So that's the chilling effect on gun violence research. But there is research happening, and we're seeing it really, I think, getting bolstered right now, but not at a sufficient level.
Okay, thank you, Dr. Richmond. There, the next question is: in the U.S., there are more than 300 million guns. That is about 1 per person. What would be the best approach to deal with a problem of this magnitude? Any one of you can jump in. I think we've been discussing handling this, looking at gun violence as a public health approach. Is there anything more any one of you want to add to this?
I'll just say for a minute, like my mantra is almost the Richmond mantra. People are used to me saying this. You know what? I'm a pragmatist. We've chosen as a society to live in a world with guns. We have to figure out how to do it more safely. And, you know, would I prefer to live in a world without guns? Certainly, but that's not going to happen. That is exactly why the public health approach is important. And I'll pass that off to hear what other people would do.
Yeah, I agree. I think it's and it's similar to, you know, when you looked at the car crash issue, they didn't ban cars. They looked at ways to work around it safely. And so, you know, when the culture is such, and, you know, our Constitution, as people keep reminding us, has the right to bear arms in it, then you can't, you know, trying to just say, you know, unilaterally that we're going to get rid of guns altogether is not going to fly. So look at ways that you can use those guns more safely. And a lot of, you know, to be fair, a lot of gun owners are worried about this. They want to utilize their guns safely. They want to store them safely, and they are worried about people who don't use guns properly. And so, you know, maybe you can look at opportunities to educate more on gun safety, you know, the distribution of gun locks, prevention of children getting a hold of guns, things like that. But the other thing we're facing in particular over this past year is the incidence of ghost guns as well. And so these are guns that are made from essentially manufacturing kits that don't have serial numbers or not and then kind of don't have any way of being registered anywhere. And so we don't know how many are out there. So that's a big problem. So looking at ways to prevent that is another way. And then, empowering the agencies that are responsible for addressing these things. For example, our ATF agency, which for years has been kind of restricted for a number of kind of similar reasons that I would say that the gun violence research has been kind of restricted, which is a lot down to the politics of it. But empowering those types of agencies to actually affect a change. And so those are kind of a few ways that if we're looking at using or having a society with guns in it, then we should look at ways how to utilize them or have them used more safely.
Thank you, Dr. Kasim. Thank you for that. I think we can wrap up for the day. It's been a great discussion, Drs. Richmond, Kasim, and Vakanma. It has been a pleasure talking to all of you. And this talk will be available on Cure Talk's website, the University of Pennsylvania's pages. I want to just share this with the audience that while the pandemic took a disproportionate toll on American life last year, there was definitely another devastating, enduring public health crisis that got worse, the gun violence. And in the last hour, you've been listening to the impact gun violence can have on health, healthcare, well-being. And the doctors, Richmond, Kasim, and Vakanma shared what each one of us can do to prevent this and how we can help with gun violence advocacy and think about this as a public health issue and prevent it. As Dr. Richmond mentioned, just come together for a common cause and have a will to get it done. So with that note, thank you, everyone.